Falls, Michigan. So very interesting case. This is a nice 53-year-old patient, had her implants done in Germany. And so she comes in with what are a lot of complaints, concerns, what are suggestive of what is breast implant illness. And over the last 3 months, her symptoms kind of went through the roof. And so she and I talked, she's been to her doc, and essentially everything's been cleared out. And this is more like a diagnosis of exclusion, if you will. And so a lot of complaints of inflammation, rheumatological joint problems, rashes, things like that. So 100% total capsulectomy, 2326 initials CS. Her implants, the one and only 2010, done in Germany, below the muscle. A lot of inflammation. So I cut out the skin. Just look how small amount that I cut in order to balance the two out. She had the capsular contracture clearly, and a lot of inflammation on her chest. So the distance from the nipple to the crease was measured to be 4.7 exactly. And the distance over here was measured to be more, so I cut out more skin. So you can see, in order to make the two sides symmetric. And remember, I'm always below the muscle. So number one, the breast tissue is not touched. And number two, I'm always below the muscle and measuring the distance from the nipple to the crease. So it's going to be the same. Now, as you will see, the capsule is so thin you can actually make out a lot of inflammation as I was dissecting hard. And as I go in, you will see what is clearly a super thin capsule. Now what is interesting is, if I go put this here, you will see no matter how thin. I was talking to a patient yesterday, and she already had her explant done in 2020, and her surgeon told her that the capsule was so thin so he could not remove it. And remember, in my practice, I removed the whole capsule, because remember, this whole surgery is about the capsule. So as I go in, you're going to see, like, look at this weepy, what is this, micro texture type of an appearance of this implant. And this tells you, look at this fluid around, right? Not enough to send, and we're going to look at it. So if I take this fluid, you will see, look at this stickiness. And remember, this is the problem with micro textured, macro textured, and any textured implants, because they cause a lot more inflammation, clinically, grossly, without a doubt. And as you will see, as I pull this out, you will see the fluid around. And if I put my hands around this implant and go like this, an intact implant, look at the stickiness. And this is now, if you will look at these implants, they're like the Preserve implant, the Motiva. They're very popular, and I will tell you, it's going to be the same problem ultimately one day. So this is your Mentor implant, 225, what is below the muscle, in brand new condition. But again, look at this. Look at the stickiness. If I did this to you, you'll see probably it's a ruptured implant. No, it's not. It's an intact implant. And capsular tissue so thin, you can see my glove. All of this tissue has been removed completely, sincerely, definitively. A lot of inflammation. And so I'm going to go ahead and put this here. So as you will see, I'm going to remove my top glove. Now let's go ahead and go to the left side, and I just want to kind of highlight this, the con procedure. This is how I do it consistently. Clearly the patient did not need a lift. Clearly the patient did not need drains, because the blood loss is less than 5 cc's. I very carefully, very meticulously, in a very careful, gentle way, literally, this is how, let's say if I'm doing the surgery, I'm dissecting like this, so that when I dissect, it's a millimeter by millimeter dissection, so that all that capsule is being lifted off. It is done very carefully, such that slowly and slowly off of the rib underneath the muscle is where the dissection is going on, and I am able to dissect all of this off of the rib in that fashion. Now, next thing here is, this is by far the most important thing. If you talk to 10 plastic surgeons, the high definition pictures and videos, this is what's going to distinguish one surgeon from the other, because this is important what I'm doing here on the table. But if you ask me, what you really need to see is the high definition pictures and videos of the chest wall showing complete removal of the capsule. This is by far the most important proof. Anyone can say anything. So that patient yesterday who had her explant done in 2020, she's complaining of anxiety, some mild symptoms of breast implant illness. She has no high definition pictures. Her surgery was done under local and her implant saline was removed. And unfortunately, she has what are residual capsules remaining behind. And now the whole question is what is going to happen to the residual capsule. And remember, you want to do this job completely thoroughly, because we know, at least in my practice, when the capsules are not removed completely, the patients continue to hurt and suffer from the many symptoms of breast implant illness, if they had any, as if they had implants. So the high definition pictures and videos of the chest wall, that's the most important. Implants are always returned to the patients to prove that the capsule and the implant was not damaged, like a saline implant was ruptured on the way out. Twilight deep sedation, this is the patient literally has a deep sleep through her surgery, no general endotracheal paralysis, intubation. Capsules sent to pathology all the time, CD30 analysis to rule out that lymphoma. This is the ultimate proof also to show that that capsule was indeed removed definitively, because they're going to measure this capsular volumes and length and diameter so that we know it was removed in its entirety. Culture sent to microbiology for aerobic, anaerobic, and fungal, and all patients, regardless of their comorbidities, get the same surgery. So as you will see right here, complete entire implant capsule removal. I'm very happy and content with how the whole surgery has gone. Again, the breast tissue above the muscle not touched at all. And as soon as I go in, you will see a lot of inflammation noted, because you can see how slippery this is. And if I may, just like on the other side, with my new sterile glove, look at this. And again, I can also, like we have done many times before, I'm going to basically get this together, and you can see, look at this slime type consistency. So this is your Mentor 225 as well, intact implant, tear shaped. Some obviously fluid, not enough to send to cytology. And again, you will see the capsular tissue so thin, inflamed, and completely removed, along with this subcutaneous fatty tissue that was part of the culprit. I found what is clinically suggestive of this lymph node right here. I'm going to send it along with this capsular tissue just to be complete. So there you have it. Complete, comprehensive peace of mind removal of the implant capsule, all inflamed tissue below the muscle. This could not be any more thorough or definitive. The implants will be again returned to the patient, capsule sent to pathology, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll hear from the patient and see how she does clinically from what are the many signs and symptoms strongly suggestive of what is breast implant illness. This is Dr. Khan, Executive Plastic Surgery.